what upgrades have been done to Bellevue's COVID ward?
All right, so what we have done is to ensure that we implement, following the guidelines and set out by the ministry, an isolation area and a quarantine space. So we would have remodeled, not put in some additional fixtures, protective devices. They are using those prospects to ensure that we have a space that we can care for our clients.
And since the COVID-19 cluster in December, when about 20 patients and 2 members of staff were tested positive, what has been the COVID situation here?
The COVID affects every community now, all right? And now we're even talking about third wave these days in some other countries. And also, that outside in the community, we have increasing number of the COVID positive. So, and our situation reflects the same in the community. Yeah. So we can say that now we have a sporadic cases in almost every ward, and so therefore from the December, I would say, the first time we had it, we've been from 10th of March when we had the first case of COVID in Jamaica, and we have been quite successful controlling the patients not to have COVID until December of last year, right? And then in December we had the first cluster. I think your team came with the CMO. At that time I was on leave. Yeah, my deputy SMO, Dr. Opiabi, accompanied with the team. And since then in December, and we have 20 plus cases. And then there was a break. But in February we have another cases coming. So since February, we have been sporadic cases coming. Yeah. So I would say now in our isolation ward, we have up to yesterday, we have 23 patients there. And in the quarantine ward, we have 11 persons. How we manage is that when the patient have the symptoms, and we move them to quarantine ward from the original ward, all right, waiting for the test results. Once they are positive, we move them to isolation ward. But luckily, from the day one, I would say from day one, when I'm counting the first cases from December until now, we have only 1 death due to COVID. Please remember that we have, Bellevue Hospital has up to last month, we have 545 patients here. Yeah, and out of that, over 400 has been discharged, as you know, and they have no place to go, so they are still with us.
In terms of patient care, I don't see anything significant, overwhelming. Every hospital has challenges, but truthfully, if I'm to do a comparison, Bellevue Hospital stands high in terms of our patient care. The shortages are there. Dr. O mentions the doctor. The shortages in nurse and other support staff, we have those, but they have been doing excellent for me in terms of patient care. Whatever resources we can afford to upgrade and do, we do that. There's always going to be those issues with shortage of human resources and other resources, but we try to make and do with what we have.
How much does it cost per month to feed and take care of a patient here?
There is a published paper already by Auditor General in 2016. I think it was tabled in the Parliament, I think.
Yes.
And also it is made public already. Bellevue received, I think, 1.9 billion, 1.6 billion, 1.8 billion budget every year.
1.8, just
1.8 billion,
1.8.
1.8 billion every year.
I don't know if you
And
have.
based on the number of patients we have, I think in 2016, when Auditor General, you can refer to it for exact figure, but I could recall that based on that audit document, per patient cost for a month is over $180,000. All right,
Yeah.
and with this number, so but the number then, 2016 and now we are a little bit down. In those days, like probably above 600. and now we are 545.
So would you say the budgetary allocation is sufficient?
Well, from my clinical point of view, if you are to observe level of standard, I would say quality of standard, I wouldn't say so at all. Because as you know, if you visit, I visited international psychiatric hospitals everywhere, United States, UK, Netherlands, Singapore, and even Latin American countries, even our brothers, sisters, Caribbean countries though, you need to talk about quality standard. Yes? Now, I'm not quite satisfied with the level of budget that we are providing for quality standard and even for the infrastructure.